Sophia. How are you feeling today?
I'm well.
Good. It's good to see you. Thank you for coming into the office. So it looks like you are on the books for a complete scalp inspection, exam, and possible treatment depending on what we find today.
Yes.
Okay, perfect. So I'm going to go ahead and begin with a bit of an inspection. So I would like to have a look and just kind of get a feel for what's going on. So I'm going to look at your scalp and your skin overall, have a look at the hairline, and then of course looking at the hair and a little bit of the nape of the neck. So we will see if there's anything concerning there. As always, I like to start with the visual inspection. So I'm going to go ahead and get my pen light. Now this is a little bright, so I would try not to look at the light directly, okay? So for this portion of the examination, you can relax. I'm going to come just a little bit closer to you and just going to be using my pen light to kind of visualize the overall area. There may be some portions where I manipulate you slightly with my hands. Is that okay?
Yes.
Okay, perfect. So just going to start by having a look at kind of the overall state of your scalp in general, the places that are visible, as well as having a look at the surrounding skin. So mainly on the forehead, around the hairline, and as well as having a look at your ear here. Now for the purposes of this examination, I will be focusing on this side today. So just having a look here for any possible signs of abnormality that I can see externally. So I do like to have a look at the skin that is just around the hairline, because that's where I tend to see some abnormality in my patients. So just making sure that I'm not noting anything there. So I'm going to turn your head towards me just slightly. Perfect. So again, just having a look around the temple area. So here I'm looking for any signs of abnormal hair loss, any abnormality in the follicle, or any signs of alopecia, which I'm not noting here. Do you see a healthy amount of new growth, which is good? Okay, having a look at the skin, all of that looks good. Skin texture is very clear, not noticing any signs of discoloration or hyperpigmentation. So pigment of the skin, is even throughout, which is good. So I'm just going to turn your head slightly here. So again, just having a look. I like to pay special attention to the area around the temples, as well as around the ears and down the neck. So just going to have a look here. Okay, so I do see one small mole here that appears normal in shape and texture. It is not raised above the skin, so that's a very good sign. And of course, just having a bit of a look here at the clavicle and surrounding areas. Okay, so having a look at your hair. Scalp appears well hydrated from what I can tell. Okay, so all of that looks okay. I am just going to have a brief look with my blue light here, and this will just allow me to rule out any signs of abnormal redness or rosacea, any signs of erythema along the hairline. So just going to have a brief look here. Okay, so all of that so far looks great. I'm not getting any abnormal coloration here. Okay. Okay, perfect. So I'm going to go ahead and put my gloves on so that we can have a bit of a closer look here, okay? Give me just 1 second. so let's go ahead and get started. And I think I do want to just move into a couple manual palpations. So it's just going to consist of me moving my fingers around in a particular motion to kind of feel around the scalp, feel for any abnormal lumps or bumps of the head area. Okay?
Okay.
Okay, so I'm just going to begin by feeling around a couple different areas here, and I would like you to let me know, of course, if anything causes you any discomfort. If you feel any level of pain or tenderness, just be sure to let me know.
Okay.
Are you currently experiencing any pain in the head area?
No.
Okay, so no signs or symptoms of discomfort anywhere around your neck or mastoid area, which would be your jaw. Good. Okay, so I'm just going to be feeling around. Start here, feeling kind of below the ear down towards the mastoid process, following that up to the temporal region. Just making sure that there's nothing below the surface of the skin that could be concerning. So I do like to just do a thorough inspection here, especially around the lymph chains. So far, not feeling any abnormality here. Pay special attention here to that temporal region. Following along the hairline. As well as assessing skin texture, I am able to feel just a little bit better for the smoothness of the skin, and so far not noting anything that I would consider concerning. Okay, so just going to feel bilaterally here, noting any differences from one side to the other. Feeling along the cartilage here. Just going to feel along the sides of your neck here. Right down that cervical chain. All right, all of that feels very good. And I just want to look here. Just looking at facial symmetry. That looks good. All right, so I'm going to go ahead and take a couple of measurements here. Mostly just measuring for symmetry and to rule out any risk of edema or swelling. So first I'm just going to bring this around. Neck circumference is right at about 15 and a half, which is well within normal limits. Also just going to measure 12 inches there, which is good. Of course. 2.5. Take off about a half inch for your hair. Good. So far all of your measurements are looking lovely. So I am just going to go ahead and, excuse me, we got a little loose hair there. Just going to go ahead and measure 6 inches in width. And even with the eyes, which is great news. So very good facial symmetry there, India. So going in with my calipers, again, this is just going to allow me to measure bilaterally here. So I'm going to start with the left side. Measuring the eye here. Perfect. And measuring the third spacing here, which is about even. Okay. Okay. So facial symmetry looks great. I think before I move on, I do just want to perform a few auscultations. So, excuse me while I just gather my stethoscope here. Now, this is going to be a little cold. I'm just going to use my stethoscope to auscultate along your face. Essentially, what that means is I'll be placing this along your skin. It's just going to allow me to listen for things like adequate blood flow and circulation. Okay?
Okay.
Okay, so I'm just going to turn your head slightly this way. And listen here. Temporal artery sounds good. Healthy circulation. No sense of occlusion. I would say we are bilaterally equal, which is really good news. Healthy perfusion of the carotid, so no issues there. So lastly, I'm just going to listen right over your eyes, so just relax with your eyes closed for me. Okay. All of that sounds great, so there's nothing to worry about as far as your auscultations go, which is good news. Okay, so let's go ahead and move on here. And I think at this point we can move on to a couple of different things. I do want to perform just a few percussions. So for that, I'm going to be using a reflex hammer here. And just to give you a demonstration, you should just feel some light tapping, maybe a sudden pressure, but it shouldn't cause you any discomfort there, okay? So I'm just going to percuss in a few areas here. Listening for any audible differences here, which so far I am not noting. So just going to gently tap along the brow bone. Reflex there as well. Okay. Alright, so we are going to go ahead and move into your scalp inspection. I think before I want to do that, I do just want to make sure that the sensory components of your hairline and your face are intact, simply because I do like to ensure that if you were to come into contact with anything potentially dangerous, that you would be able to feel it appropriately. So for example, if you're cutting your hair or using any sort of sharp object, I want to make sure that you can feel that and that your tactile sensory components are intact in an effort to ensure that you're not injuring yourself on accident, okay? So I'm just going to test a few different components here. I will start with something very basic. So I'm going to test bilateral sensation. Now you have two different objects here. They are both identical in texture, although color is different. I would like you to indicate to me whether or not it feels exactly the same on both sides or if there is a difference in sensation. So for example, if you feel that this is soft, but for whatever reason on the other side you feel that it's not as soft, just let me know.
Okay.
Okay? So I'm going to start here. Do these feel the same?
Yes.
Okay. This feels the same?
Yes.
Okay. Does here feel the same?
Yes.
Good. Same?
Yes.
Same?
Yes.
Good. And lastly, does that feel the same?
Yes.
Perfect. Okay. Okay. Now, testing for pressure sensation, I'm going to use this acupressure tool. It just allows me to apply a certain amount of pressure to your skin. Now you should be able to feel it prior to any pertinent indentation there. So can you feel this?
Yes.
Okay. So same thing, you can either say yes or just nod your head if and when you feel it, okay? So close your eyes for me. Feel that?
Yes. Yes.
Good.
Yes. Yes. Yes.
No, not as much there.
Yes.
Okay. Now does that feel the same as this?
Yes.
Okay, good.
Yes.
Yes. Okay. Maybe not as much there.
Mm-hmm.
Does that side feel the same as this side?
Yes.
Okay. And then you can feel this all here.
Mm-hmm.
And that should feel the same as this side here.
Yes.
Okay, very good. All right. This sensation is slightly different. I would like you to let me know if the sensation differs as I move down the area. So for example, if I move from your forehead region down the sides of your face, does it get number at any point or does it feel the same essentially throughout?
It feels the same.
Okay, so same thing on this side. Any difference in sensation there?
No, it feels the same.
Should feel the same forehead, nose, and chin.
Yes.
Okay, and then both sides here should feel the same.
Yes.
Perfect. Okay. All right, India. So let's go ahead and move on to your scalp exam. If I could just ask you to let your hair down for me so that I can have a look.
Okay.
So we are going to go ahead and begin with your scalp inspection, and I'm just going to have another look with my light. So, of course, just looking at the overall state of your hair. Now you do have extensions in place, so I will keep that in mind, but I also want to have a look at the scalp itself and ensure that the follicle is intact and that there are no signs of abnormality here. So I'm just going to start by looking at this first section. So far, not seeing any signs of abnormality. Scalp color and texture is normal for age and ethnicity. Not seeing any signs of abnormal discoloration in this area. As well as textural abnormalities, everything looks okay. So, just making sure that I'm not missing anything. You do have very beautiful hair. I'm going to start up here. I do see just a little bit of flaking, which is totally normal. Also having a look at where your natural hair ends, which appears to be about here. So ensuring that I thoroughly look at any of these looser ends. Again, just a little bit of flaking here. It does appear that as your scalp is slightly dry. Do you tend to suffer from a bit of a dry scalp?
Yes.
Every now and then. Do you use anything for it? Are there any products that you apply or oils that you apply to your scalp on a regular basis?
Yeah.
So hair follicle is intact. I'm not noting any signs of acute folliculitis or anything that would indicate dysfunction of the follicle itself, which of course is where your hair grows from. So I like to have a look and make sure that the follicle is intact and that there's not any signs of weakening there. Just manipulating slightly, looking for any signs of excess breakage or weakness, any areas that could be of concern. I tend to find that a lot of that happens at the front portion of the head, so just checking for any signs of traction dysfunction here. So women tend to pull our hair up into buns or ponytails, and all of that tension can weaken the hair follicles. So just paying special attention to these areas. Everything looks good. Your hair is very healthy. So I'm going to go in with my blue light now that the scalp is exposed. Looking at the individual strands here. A closer look at the hair shaft. Very good. So just a little bit of that flaking that I do think we will be able to treat in office today. So that is good news. So I'm going to go in with a different light, and this is actually called an ophthalmoscope. And this is going to allow me to have a bit of a closer look at the scalp itself, okay?
Okay.
So I have a little light here, and I'm just going to be coming very close to you. This is going to essentially allow me to have a magnified view of your scalp. So excuse me while I come in here. Just using this to have a look. Okay. That all looks really good. Just having a look at the individual braid here, looking at the follicle as well as the hair shaft. Now I do see a little bit of that flaking, but it doesn't appear to be anything concerning. Nothing that I would consider abnormal, nothing that requires any form of medication, which is good. Okay, very good. Okay. So I'm going to go ahead and palpate around your head now. So again, just let me know if there's anything that's uncomfortable, any areas that you find particularly tender or painful, okay? So I'm going to begin at the base of your head here. So just going down the cerebral structure. Don't feel anything abnormal here. Feeling for any abnormal lumps or bumps beneath the surface of the skin. So just following along a bit of a pattern here. I do not feel anything abnormal thus far. Scalp texture is very smooth. Does not appear to be any abnormality in texture, no signs of injury, not noting any abnormal lesions or bruises, which is great. Feeling at the crown. Any tenderness here?
No.
Good, okay. Just going to separate a section here. Another section back here. So working in this pattern just allows me to ensure I'm not missing any of the areas. So I do like to make sure I do a thorough inspection. I would hate to miss anything that could cause you any issue later. Just ensuring that I feel around every portion of the scalp. Okay, and then lastly, are there any signs of abnormality on this side? Having a bit of a look here. Alright, so let's go ahead and move on. I think I would like to go ahead and percuss along the scalp. So again, any areas that are uncomfortable or cause you any pain, please do let me know. Just using a smaller hammer here so that I can get into these more intricate areas. Okay. Alright, so I think what I'm going to have you do, Miss India, is turn around for me so that I can have a look at the back of your scalp.
Okay.
That'll also put you in a little bit more of a relaxed position so that you can just kind of hang out for the rest of our inspection today, okay?
Okay.
Okay. I will assist you in turning around here. Okay, so following along in our scalp inspection, I'm just going to have a look here at the back portion of your head, hair, and neck. So just having a look at the overall. And I'm going to go ahead and part your hair. Good visualization of the scalp here. Just going back in with my blue light. Just looking for anything that could be concerning here. Not seeing any signs of discoloration at the back of the scalp. No signs of abnormal redness, erythema. Nothing is abnormal in texture, which is great. Again, just having a look at the hair itself. Ensuring that there's nothing concerning here. So, of course, looking for any signs of infestation. Definitely not noting any signs of head lice or mites. There are no ticks present. Again, just some slight dryness and product buildup here. Totally normal. See some light flaking here. Moving over. I'm going to go ahead and repeat that test for neurological dysfunction. Now, don't have to respond for this portion of the examination. I am going to just look for certain reactivity of your neurological function. So I will be applying some very specific stimuli to the scalp. Just looking for a specific reaction here. So you just relax for me. Of course, let me know if any of this feels abnormal, uncomfortable, or painful, okay? This is just a very soft sensation. Just applying this to different areas of the scalp. Looking for any indication that something could be wrong neurologically. Are you able to feel this here? Okay, good. Any difference here compared to here? Does that feel about the same?
Yes.
Okay, good. Just producing a light puff of air on the scalp. Okay, so all of that does look normal. Just going in with my sharp sensation, again looking for that normal or what I would consider within normal limits of neurological response. So again, just testing your sensory components, as well as utilizing this tool to stimulate the follicle. It will allow me to visualize any areas of sensitivity. So just going to manipulate this along the scalp in certain areas. Very good. Very good. Okay, so moving on to testing for our cold sensation. Now I have a couple ice globes here, and I'm just going to be testing bilaterally for temperature abnormality or temperature variation. So two very cold objects here, and again, just looking for any abnormality in your sensory perception here. So these two objects should feel equally as cold. And you just let me know at any point if they do not feel the same. So everywhere that I touch you, they should feel the same. doing really well. Okay, I'm going to move on and I'm going to do a bit of an inspection of some of those drier areas. I'm just going to move a little bit closer to you here and use this section here. Having a look at this area using a little spoolie to allow me to manipulate the hair and better visualize some of these drier patches. So just very slightly brushing at the scalp. Was able to dislodge. Just having a look here, noting any possible signs of abnormality, which I'm not seeing. It does appear as if this is just dead skin cells that have shed, which is completely normal. So it's good that we were able to verify that. Just looking at a secondary portion here. So all of that does look great, so no cause for concern there. Now we can move on to the treatment portion of our examination today, and I do believe I am going to be able to treat this topically. So what I'm going to do is begin by focusing on the back of your head, I'm just going to section off a few areas here and apply the treatment as necessary. So just sectioning off this bottom portion to begin with. Okay, perfect. Let's go ahead and begin by applying our treatment to the affected areas. Okay. Just applying a very small amount of our treatment here to the areas of the scalp that are visible. Now this is very viscous and potent, so we don't need very much in each of the designated areas. And I will just begin by distributing with a sterile cotton tip here. So just the treatment into these different areas in an effort to hydrate the scalp. Moving on to our next section. To do the same thing. Just applying a small amount here. Let's go ahead and distribute this thoroughly. Apologize for the disruption of the helicopter. It does appear as if the emergency department has received an intensive case. conclude the treatment portion, I have applied our serum here to the areas that are most affected, and I would like you to leave that in for at least 48 hours if possible to allow your scalp to reap the maximum benefits. That is, it is a very potent over-the-counter serum, and I do like to have my patients leave it in for as long as they can before washing their scalp. Now, something that we discussed via your portal prior to your examination was that you were experiencing some slight stress, which is totally normal. Of course, as we move into adulthood, we all have some stress in one way or another. Now, as a provider, I do like to provide my patients with different means to alleviate that stress that are not necessarily medically focused. So sometimes we have internal stressors that we can deal with in an external manner that does not require medication. So I am going to go ahead and provide you with a very mild massage here just to kind of help alleviate some of that stress and tension that you've been experiencing. So just relax for me. I'm just going to start by, as with anything, palpating around the shoulder area. So looking for any signs of tension here. Sometimes our internal stress is caused by external factors, so I do just want to feel around here, feel for any signs of excess tension, any knots, anything that I think could benefit from a more holistic approach. So I can always refer you to someone like a chiropractor or a massage therapist. So just feeling around here. I am feeling some areas of tightness, so nothing that I would say is an injury, but it does feel like you have been holding on to some tension in this region. So just feeling for any differences bilaterally. Of course, feeling along the thoracic spine. Just going to palpate along here as well. Just percussing the spine. Listening for any audible abnormalities here, or anything that I would think is maybe the reason for your tension. I'm going to go ahead and begin here with relieving some very specific areas that I do feel are rather tight. So it does appear as if you have some muscle strain here. Just kind of applying a very gentle release of that pressure, encouraging lymphatic drainage and any excess fluid buildup to alleviate any of that discomfort. Always working outwards, away from the heart. And working in a circular motion. So I do feel something here. Just manipulating these pressure points here. I'm noticing a release of some of that extra tension and fluid buildup, so that is good. And manipulating away from the spine. Along the spine. Lastly, I am just going to take my Gua Sha tool here, and I'm taking the side that is slightly variegated so that I can just more precisely manipulate these intricate areas. So applying a firm but gentle pressure down and out, again encouraging lymphatic drainage and encouraging any excess tension to release away from the base of the neck, down and out towards the shoulders. Really feeling a difference in tension there, so you feel a lot looser. That excess tightness has dissipated, which is great news. Lastly, I'm just going to fan away any of that excess tension. So just to feel around for any hot spots, and then encourage that extra release of tension. Okay. Well, India, I think that will conclude our scalp exam. I was able to have a very thorough inspection of all aspects of your head, as well as your face, neck, and spine. Now, the only abnormalities I would say that were found, not that I would consider them abnormal, but you do have a slightly dry scalp, so I was able to treat that topically. I would recommend that you use something like a castor oil or coconut oil, even like a jojoba oil, something that can penetrate deeply into that follicle and better hydrate the scalp. Overall, it does appear that you are taking very good care of your hair. And there wasn't anything that I found too concerning. You did have a little bit of tightness in the shoulder area as well as in the upper back, thoracic spine region. Now, I was able to mitigate some of that with some massage therapy. So if you would like, I can give you a referral to a colleague of mine who specializes in Eastern medicine. Now, she is a massage therapist and she can better treat these symptoms for you. I was able to relieve some of that excess tension and lymph buildup today. So do recommend that that is something you follow up with if you are interested in further treating this area of tension. Okay?
Okay.
All right. So other than that, I would say everything went extremely well. You do have very healthy hair as well as a very healthy scalp. So aside from adding in some excess moisturization, I would say that you are doing everything right, and I don't see a reason for you to need to come back unless you are feeling any signs of abnormality or you think something concerning is going on. Otherwise, I would like to see you back in about 12 months at your annual appointment, okay?
Okay.
Okay. All right, India. Well, thank you so much for coming in. I will allow you a few minutes to gather your belongings, and I hope you get home safely, okay?
Okay.
All right. Thank you very much.